My name is Eddie. Last week I celebrated my 86th birthday. I am married to Joyce. We've been married for 58 years as of this past December, and look forward to another 58. I have considered myself healthy most of my life.
A few years ago we had vascular issues, first in one leg and then in the other leg.
I believe the onset to my issues began last year. I swim a lot and I swim many laps, and I couldn't swim more than a lap without having a chest pain. It wasn't really like loss of breath, but it was a pain different, and I had to stop.
We were in New York City and we walked 2 miles to the theater district last December with no problem, and he could hardly walk back. Then we came back to Scottsdale.
I went to the symphony and walked to the symphony with no problem, and after the symphony was over, I couldn't walk more than a half a block at a time to get back to the car.
And there was one more incident. Why we waited for 4 horrible episodes, I don't know.
Ed came to us with a number of cardiovascular problems. He had peripheral vascular disease. He had aortic stenosis. He had coronary artery disease. He had so many things going on at once that we needed to address at one time. We knew, because of all of the medical problems that he had, that he wasn't going to be an optimal candidate for traditional surgical therapy, such as bypass or surgical aortic valve replacement. So we had to do a little thinking out of the box and ask ourselves, could we do these procedures non-surgically using catheter-based therapies?
Ed was sort of a poster child for us really having to function as a team.
The goal of the HonorHealth Cardiovascular Center of Excellence is to be able to treat all different complexities of cardiovascular disease. And it's an amazing asset here for our community to have world experts in complementary aspects of cardiovascular care.
We couldn't address it all in one setting. We had to stage his treatment. We had to treat the vascular disease first, then we had to treat the coronary disease, and eventually we would treat the aortic stenosis. His was such a fascinating case that Bob and I approached him regarding doing this as a live case for the Society of Coronary Angiography and Intervention.
Really, his case exemplifies what we need to discuss as a heart team. You really do need the entire team to come together, and being able to do this as a live case and provide that for Sky, I thought was an awesome opportunity.
Good morning, Dave. How you doing?
Good morning, David. How are you? I'm going to get right into it because we got a lot going on. So what we did is we performed the peripheral vascular procedure and the coronary stenting procedure live, and then 1 week later we did the definitive TAVR procedure. Coronary angiography performed several weeks ago. You see just how much calcium occupies the lumen of that LAD beyond the main. We knew that we would have to perform an implant in order to successfully stent his coronary arteries.
A pump was inserted to help with the heart function. The pump can help support the body while the heart's not doing the job.
When we use a heart pump for high-risk stenting procedures, it allows us to perform that stenting with lower risk to the patient.
We noted that the arteries of his legs, through which we would pass the catheters to treat his aortic stenosis and to treat his coronary disease, had blockages. Because of his lower extremity vascular disease, we knew the tools we would need to get to the heart to perform TAVR and complex stenting, it wasn't going to happen.
Fortunately for us, we have this new technology called intravascular lithotripsy. It's akin to kidney stones. We pass a balloon to the areas where the artery is narrowed. We then inflate the balloon, and the shock waves cause an implosion or a fracturing of the severe calcific disease, allowing us to safely dilate these vessels and allow passage for larger devices to get to the heart.
The case went exceptionally well. We accomplished everything we intended to do. We fixed the blood vessel in the leg, allowing us access to the rest of the heart where we were able to fix the blockages in the arteries. We were very pleased with our results, and the panel of experts who were watching the live case were equally impressed.
So Dave, this is quite a tour de force. I think this is a remarkable demonstration of a number of things that we think about, but we never see in all in one place. And it's great work.
Great job. Thank you.
Thank
Very
you.
great job.
When we did the live case with Eddie, everything went great. And then a week later, we treated the aortic stenosis by implanting a TAVR.
Aortic stenosis is a situation, unfortunately, where one of the most important valves of the heart doesn't open as well as it should.
The treatment for aortic valve stenosis is to get a new aortic valve. Traditionally, this has been with open heart surgery. We have now been lucky to have progressed to the point where heart valve replacement or insertion can be performed through minimally invasive techniques. We call that TAVR.
So the second one, they said was like a piece of cake. It was just a normal procedure, like everybody else. But the first one was the really difficult one, right?
Yes. Well, it wasn't difficult to me. I didn't know anything. I am really amazed at what was done and how the two surgeries were performed. The recovery period was easy because there was no evasiveness. I felt fine. I returned to doing things that I was accustomed to doing in a very short period of time. So I really had no anxiety in this whole process, knowing it was a very serious procedure. Maybe I took it too lightly, but I think the attention I received and the kind of attention was responsible for that. I really thank them for restoring me back to where I was.